I'm glad I'm a cat. Meow.
Your blood vessels
Are not supposed to freestyle like this. But sometimes arteries and veins connect in a tangled little chaos ball called an AVM. And yes, that can become very dangerous. Meow. An arteriovenous malformation, or AVM, is a defect in your vascular system. That's your body's network of blood vessels. Your vascular system includes arteries, which carry oxygen-rich blood from your heart to your tissues and organs. Veins, which carry blood and waste products back to your heart. Capillaries, tiny blood vessels that normally connect arteries and veins. Now here's where things get hysterical. An AVM is an abnormal tangle of arteries and veins connected directly to each other with no capillaries in between. Human body design flaw: his. Normally, capillaries help slow blood flow down. But in an AVM, blood rushes directly from the arteries into the veins much faster than normal. Because of that, nearby tissue may not get enough oxygen, and when tissues don't get enough oxygen, that can lead to tissue damage and the death of nerve cells and other cells. Tiny furry fact-checker strongly dislikes this. The fast blood flow can also increase pressure inside the arteries and veins, weakening them over time. A weakened blood vessel can burst or leak blood. Very bad. Very not the cat's meow. AVMs are rare, and doctors don't know exactly what causes them. Most people are born with them, but sometimes they can appear shortly after birth or later in life. Symptoms depend on where the AVM is located. They can happen anywhere in the body, but they're more common in the brain or spinal cord. And here's the sneaky cat burglar part. Many people with brain or spinal cord AVMs have few, if any, symptoms at all. But if a weakened blood vessel bursts and bleeds into the brain, called a hemorrhage, it can cause a stroke or brain damage. Hiss. If an AVM does cause symptoms, they may include seizures, headaches, pain where the AVM is located, vision problems, muscle weakness, problems with movement or speech, confusion, dizziness, loss of consciousness. To diagnose an AVM, a healthcare provider will ask about symptoms and medical history, do a physical exam, and may listen for something called a bruit, a whooshing sound caused by rapid blood flow through the AVM. They may also order imaging tests like CT scans, MRI scans, ultrasounds, cerebral angiography, where a special dye helps blood vessels show up on X-rays. Treatment depends on where the AVM is, its size, your symptoms, your overall health, your risk of bleeding. Treatment options can include monitoring the AVM, medicines to help with symptoms, or surgery if there's a higher risk of bleeding. There are different types of surgery for AVMs, and sometimes more than one procedure is needed. Surgery can be risky, especially in the brain or spinal cord, so doctors carefully weigh the risks and benefits before making a decision. Subscribe now for accurate health info. Meow.